Pediatric California Chapter 3 Pediatric School Health Conference. I will introduce myself in a minute, but I want to tell you about several things. First of all, I would like everybody to see what name they have on their screen. And if it's just a phone number or it doesn't identify you by first and last name, please change that so that it does reflect your first and last name. And if you don't know how to do that, look into the chat box because there are instructions of how to do that. That is important because that is the only way for us to confirm that you were really here. The second thing, the other technical thing to do is to mute yourself if you're not already muted. That does definitely help with extraneous noise and helps the speaker quite a bit. Next slide. So there are slides that you will be seeing, and the handouts reflect those slides. And if you would like to get those, go to www.aapca3.org and scroll down to School Health Conference banner. And there's a password, SH20. And you will be able to get all the handouts and all the slides that you're going to see today, plus the ones that you may have missed last week if you weren't there. Next slide. The next slide is, this is the list of who is going to be speaking. I am first. I will also mention to you that for the CME credits, aside from changing your name and making sure your full name is on the screen, I want to let you know that you will receive an email sometime this evening, or if not tomorrow, that you will have to open and respond to questions, evaluate the conference. And if you do those two things, you will be eligible for your CME or your CEU credit. So make sure you do that. That's the only way you will be able to get credit for that is if you look at your email tonight or tomorrow. So my talk today, I'm going to put my slides on here right now. Share. Can everyone see my slides?
Yes.
Okay, so I thought, first of all, my name is Howard Taras, and I am on the School Health Committee for the American Academy of Pediatrics. I am a professor at UCSD, and I'm a doctor for many school districts. And aside from giving you a short talk today on a school health topic, I'm also going to introduce the other speakers. I thought I would talk today about virus testing in schools because it is something that you're beginning to read about in the newspaper. And many of you who work in schools are hearing about it. Perhaps a lot of it depends on the size and nature of your school district. And when I talk about testing for virus with relation to school, here I'm talking about asymptomatic screening. So basically getting all teachers and asking them to get a screen virus test before they come to school. And then every week, every 2 weeks, every 4 weeks, every 2 months, some periodicity, or I hear they're calling it cadence, thereafter, in order to capture those people who are asymptomatic positive and to have them refrain from coming to school. Other schools are not only considering this for teachers, but they may be considering this for students. So I thought I would talk a little bit about the kind of decisions that schools may be faced with over the next couple of months, probably through the early next year until we really know how this is going to work, if at all. The first thing that many of you hear about is antigen test or PCR test. Of the two, PCR test is one that most everybody has received, unless you're in a nursing home, because it is far more precise, it's far more accurate test, probably much more specific to this virus. And it takes 24 hours. And if you have been tested before you went for a medical appointment or a medical procedure, or if you have been tested because you went to a county site, you were probably tested with the much better test, the PCR test. The antigen test has been the one that the White House was using. They were using it for screening. It is a test that is usually cheaper. Unlike the PCR test, it doesn't take 24 to 48 hours to get the result. Sometimes it can take as little as 15 minutes to get the result. And a lot of it can be done what we call right on site, a point of service test. And that means for in some ways, that test seems like it could be the better one for screening. So there is a committee in San Diego that consists of some epidemiologic specialists, as well as some laboratory specialists from many institutions, from Scripps Clinic, from UCSD, from Sharp, from the county, from different laboratories. And these specialists have gotten together and decided, is the antigen test really something that, you know, should even be used? And their conclusions, which were sent to Dr. Wilma Wooten recently in what they called a white paper, was that, you know, if you're going to use the antigen test, it has enough false positives that if someone were to be positive, you needed to follow up with a PCR test. But that there are circumstances where it may make sense for screening. The problem is that there are no antigen tests that are yet licensed by the FDA for screening. So for schools to adopt this as a screening test, you know, there are still some regulatory problems and hurdles that we would have to go through. They say that one day they'll be as low as $5 a test, but right now they're more hovering around $30, $40 a test. So that's one of the problems that you have to deal with an antigen test. The other problems are regulatory, such as who can actually do this? Does a nurse have to be there? Can the person do it themselves, whether it's swabbing their nose or spitting into a cup? And then do you need a lab waiver, a CLIA waiver, which is a regulatory federal agency, to actually process the test on site if you're doing it as part of a screening program? Right now, antigen tests are being used mostly that I can see in skilled nursing facilities where they're being used for symptomatic people the way they're licensed. They're probably being misused frequently. When I say misused, I mean against current FDA regulations as a screen for asymptomatic people, but those are the hurdles with those. Should this be the kind of test that is done on a school site or off a school site? Well, right now, the county is offering PCR tests, and they have the capacity that they're not really questioning as to whether this is for symptoms or asymptomatic. They will probably do it for you regardless. They're using Helix, which is a very good test. It's PCR. and but they're all off-site. There is no school sites that are offering this free test from the county, even though technically we maybe shouldn't be using it just for asymptomatic screening. They're not turning people away. The problem with Offsite is that if the county is doing the test or your own private doctor is doing the test, the school doesn't necessarily get that result. And the other one is that it's a bit of a burden if you're supposed to go every 2 weeks for a parent to start taking all their children and going off to a test that there may be lineups, they may need to have pre-booked in advance. If you do it on site, you can take a class of 20 kids and pull them all out and do the test right away, which means you'll get really high numbers of people who get the screen. Should we be testing staff only or students too? Right now, the California Department of Public Health is only recommending that staff get tested and once every 2 months, and they haven't addressed students as well. However, large city school districts across the state of California and large city school districts across the country are putting a lot of pressure on their school systems to have staff and students tested before schools really get going with a lot of people on campus. So there's a lot of political pressure for this to occur, and the state, I don't know if they will be able to respond to that. These are, again, expensive to do even at their cheapest when you start talking about high frequency and high numbers. Should they be mandatory or merely encouraged? Well, any school district could probably make it mandatory for staff members if their unions agree to that in order to get high participation rates. Public schools could probably not make it mandatory for students to get this test because the kind of education they would get online versus at school would be significantly different. Private, unless the state mandated, they could mandate it just like we mandate vaccines. But right now it would have to be merely encouraged for students in a public school. Who gets the results is very important. If the school can't get the results, even anonymous results, we don't know who was positive, but we know how many people took it at any school site. If we don't get the results, you don't have a denominator. So you can't really say, you know, you can't really gauge how often to do it based on your percent positive when you don't have a denominator of knowing how many people at any one school site actually got that. So that's an issue. Who pays for it is an issue. Right now, the state is looking at a model where teachers' insurance would pay for it. The problem with that is then insurance premiums go up, and then the school district has to end up paying for it in the year later. Instead of paying by test, they pay for it by having increased premium costs. And the insurance companies have all said, if we have to pay for it this year because of a state mandate to pay for screening tests, we will just increase premiums next year. How often and what is the estimated benefit? I do have another slide and I will quickly go through it because I think it's 6:45. But essentially, people have heard of the R0. That's how many people you're passing the disease to. So the R0 is really now between 1 and 2. Any person who becomes positive with COVID is going to pass this on between 1 to 2 people on average. If it were higher, it would be 2 to 2.5, 2.5 to 4.5, etc. There's some people that are super spreaders because they're around a lot of people without a mask when they're positive. But on average, we're more like, I think, under the 2. So they say that you can vary the intervals of how frequently you test people in order to keep rates low in the community or in any institution like schools or a business by changing the, by looking at how frequently people are passing this along. And that would tell you how effective it is. In my opinion, if you are doing all the mitigating factors, if there's no one in schools without their mask on, if people are apart, if everyone is doing all the mitigating factors and the ventilation in the room is excellent, then you should have very few school-based transmissions. So if testing is going to decrease, you know, a very rare transmissions by 70% or 80%, that could be a tiny figure. If you're only having one transmission per 1,000 people, then 80% of that, you know, is not going to give you as much cost-benefit ratio. So those are the issues that we're thinking about with testing. I thought maybe you would just like to know all the factors behind that discussion.